All right, greetings from the Financial Consulate. I'm Roger Bair, joined by Graham Ewing. Good morning, Graham.
Good morning.
We're here to talk about Medicare
We-
and not for retirees.
We are. So 10 things you should know about Medicare. That's the topic. There aren't 9 things, there aren't 11 things, there are 10 things.
Just 10 things.
There are. So today we're going to go through all of those 10 things. And at the beginning here, I want to just give you a little bit of a preview. And that is the first one. We're going to go through the difference between Medicare and Medicare Advantage. A lot of people have questions on which one to pick there. And then within Medicare, Part A, what's it cover? Part B, Part D, what does Part D cover? And then Medigap. IRMA, what is IRMA? What does IRMAA stand for? And then we've got another code here, SSA 44. It's a really important thing, and not many people know about it. So we're going to cover that. And then there are some things actually the Medicare doesn't cover. So what are we going to talk about there? And then, of course, the timing. You know, what do we do? A lot of people know that this is something you sign up for at age 65, but we're going to dive just a little deeper into that. And then how to get started.
How to get started. And of course, Graham, I'm of Medicare age. I've passed it
I wasn't
a year ago.
anything.
No worries. No worries. So I've been through all of this, so I can shed a little personal light on these 10 things you need to know. We need to know.
Yes.
Yeah. And so let's go.
Dive in. So original Medicare versus Medicare Advantage. Trying to make these slides a little more entertaining. So we've got some pictures. You ready for the first picture?
I'm ready. I'm ready. Go
so
ahead.
We've got Godzilla versus King Kong.
Okay, I was going to say, who's the guy on the right?
Yeah. Okay, that's right. So Medicare versus Medicare Advantage. These are the two big decisions when people retire. What do you go with? And I think on the surface, a lot of people say Medicare Advantage looks good. So why is that? I think the big one, you see these commercials on TV all of the time. I think, was it Joe Namath?
Joe Namath.
There's a couple of
somebody else.
all the time. And they say it's cheaper. You don't have to pay a premium. And that's true. You don't have to pay a premium for Part B. You don't have to pay a premium for a Medigap plan. And you don't have to pay a premium for Part D. And on top of that, wait, there's more, right? It gets better. There are cherries on top. And those cherries on top it comes with dental insurance. It comes with vision insurance. And we're going to talk about more of that later in the slides, but it looks appealing.
It looks appealing. And unfortunately, this is an example, or maybe fortunately, this is an example of where cheaper is not necessarily better.
Well, and to stick with the entertaining slides here, if anybody's seen the movie Mr. Deeds, we've got Emilio here saying, "I am very, very sneaky, sir." And that is Medicare Advantage.
Very, very
that
sneaky.
is Medicare Advantage. Because what's happening, really, as we know, is that Medicare Advantage is really pulling the strings. So you want to go through kind of how that works in terms of what you're able to do, what you're not on Medicare Advantage?
Well, the thing I would say to you, Graham, is that Medicare Advantage entails a much less flexible program than Medicare. That is, it's more like an HMO. You are not going to have the ability to choose any physician to go anywhere for your care. And if you are more worried about flexibility, or you don't mind inflexibility, maybe Medicare Advantage is the way to go, but we are inclined to doubt it.
Well, and if basically, if you can afford original Medicare, that's really the most comprehensive coverage. You're not stuck in this network that you're talking about. In some places, it can work really well. We're really close to Johns Hopkins. There's plenty of people that are on Medicare Advantage that's associated with that, but it can become pretty dicey if you have some type of disease or something down the road that isn't really covered the best by that network, and you need to go out.
Well, and I think you said it. If you can afford regular Medicare, you ought to use regular Medicare.
Right. And speaking of that, so here we go, on to the next slide. Enter original Medicare, Batman. Okay, here to save the day, original Medicare. But really, Medicare is not necessarily one superhero. it's more like the Avengers. So anybody seen the Avengers? We've got all the different characters in there kind of working as a team to get you the best coverage. So let's go into this. So part A, number 2 here, part A, what does it cover? Covers hospitals. And so you think about any kind of overnight hospital stay, not outpatient, but hospital stays is generally where part A is coming into the mix. So Tony Stark's here, Iron Man. It is seen as free, right? So there is no premium. You don't have to, when you retire, it doesn't come out of Social Security, but we're saying here prepaid.
Yeah, you paid for Medicare Part A all of your working life. So we can say it's free, but as our economic professors said, there's no such thing as a free lunch.
No such thing as a free lunch. That's right. And but nonetheless, it is something that's important to have. So Part A is one of those parts of original Medicare. On to the next one, Part B. So Thor here is going to help us, and that is that coverage is for doctors. So anytime you go to a physician, checkup, etc., that's where Part B is really coming into the mix. The premium for Part B does come right out of Social Security if you're collecting Social Security. If you're not yet collecting Social Security, you actually pay quarterly.
You pay a bill.
You pay
the bill. That's right.
Pay the bill, right? And here's a tricky part. If your income is higher, your premium can be higher. So premium is higher for higher income households. We're going to talk about that. That's one of the villains of this story, and how we might want to try and get around that.
Well, and this is the part of the plan that differs significantly from Medicare Advantage, because within Medicare Advantage, again, you're not going to be able to go to any doctor, whereas plain Part B Medicare, you can go to your doctor, all doctors.
Almost all doctors
except Medicare. Right. That's correct.
Right, exactly. So Part D, notice there's not a Part C, we'll get to that, but Part D covers drugs. So think about the prescriptions that you have. It's going to vary. The plan that you pick is going to vary depending on your formulary.
I just was wondering what drugs the Incredible Hulk took to turn green. He's green? Right?
He is green. That's right. You're
colorblind,
right?
Yeah. So he's green and he's looking pretty aggressive.
He is looking aggressive, and you want to have an aggressive drug plan that's going to cover the drugs that you take. Yeah. I don't know if there's a plan out there available for the Hulk, but for the rest of us, Medicare,
I'm on Part D.
Yeah, no worries. Yeah. So formulary, just to back up there. So what is a formulary? Many people might know this, but some might not. So it's an official list giving details of medicines that may be prescribed. So it's your list of drugs, and you go on to Medicare's website. You put in all your drugs, and it's going to give you a good idea of what's the best plan for you. You don't want to just go with the cheapest plan from a premium standpoint. You want to look, does that plan also cover the drugs that you're trying to get? Because if not, you're going to have a big bill when you go to buy those drugs.
Right. This is actually a part of the Medicare website that functions very well.
Very well.
So you can go to the Medicare website, as Graham said, put your drugs in, search by geographic area. You can put your zip code in and find out if you have a CVS or a Walmart near you that will cover the drugs that you take.
Indeed. So the last part here of Medicare, original Medicare, is Medigap. And sometimes you'll hear this called a supplemental plan. It's basically the rest of the team coming in here to fill in all the gaps. So the analogy that I've heard is it basically turns Medicare from Swiss cheese to cheddar cheese. We've got the holes in the Swiss. There are no holes in cheddar cheese. And we all know that cheddar cheese is better than Swiss cheese anyways.
It depends on what you like on your sandwiches, Graham.
It does. It does. Maybe I have an opinion on this.
Indeed. I don't know. It sounds like you do, but Medigap is a very good title for this because there are gaps in Medicare coverage, and the Medigap plans fill in those gaps.
Right.
And so you ought to have one.
You ought to have one. And some people, when they retire, they can get a supplemental plan through their job. So they retire. It doesn't happen as much as it used to, but government agencies, are the main ones still today that provide retiree health insurance. That retiree health insurance generally, once you reach 65, will work in conjunction with Part A and Part B, sometimes Part D if there is no drug coverage on the employer plan. But just know that for anybody that doesn't have a retiree health insurance plan, that's where you need to go buy a private insurance policy, a Medigap policy on the
there
market.
are gaps and holes in the coverage. Yes,
Right,
indeed.
right. So just to show you here what this covers. So you look on the left, we've got a big chart here. Look on the left. So there's basic benefits, Part B coinsurance, skilled nursing, Part A deductible, the whole gamut there. But if you look at the different columns, you can see there's a whole alphabet of different options. These are all Medigap options. They are standardized across the country. A in Maryland is basically the same thing as A in California. There are some small distinctions that we're not going to get into today. But if you look here, you can see, well, where are the most check marks? Well, Plan F is really the best policy. There's one problem. It's not available anymore. You can't get it. I think it was 2020 was the last year, and 2021.
Not available.
Not available anymore. But the next best thing is Part G. Plan G. And that covers everything except for the Part B deductible. And the Medicare Part B deductible, I think, is around $150. Maybe it's up to $200 now. Right. So it's not a big deal that it doesn't cover that. So generally Plan G is what makes sense, but you do want to talk to somebody to make sure you've got the best, most appropriate plan.
Talk to an agent and use Plan G. It's the best. And as you said, the coverages are standard.
Right.
Across the country, across the spectrum.
Right. Now the premiums are not standard. So if you'll find some carriers will look like it's a really cheap plan at the beginning of your retirement, and then sometimes they will jack up the plan later in the later years
as you age.
So you really want to think about not just the first year premium, but what makes sense for the entire duration of retirement, going with a more reputable company that's been around for a little while.
So you need to shop around.
Right. And we'll talk more about that in a later slide as it pertains to getting started. So these are all the things that Medigap covers, filling in those holes. The total costs for Medicare come out to around $350 per month. So Part A, we talked about, was free, right, or prepaid. Mm-hmm. Part B is about $165 a month. That'll change likely for 2024, go up by a little bit. Part D can vary. It can vary. Some are as cheap as $7. Some are more expensive, like $60, but we'll put an average in here of about $30.
That's a reasonable estimate.
Right. And then last but not least, Medigap. Generally, we'll charge about $150 for a Plan G. It varies again by state, varies again by carrier, but it's going to be close to that $150 per month premium. All right.
It's great coverage for $350 a month. It's really excellent coverage, and really you can't beat the price. Actually,
you can't beat the price unless good segue, Roger. We have the villain here. This is not Ursula. This is Irma. And Irma stands for income-related monthly adjusted amount. So number 6 here is this little thing that many people don't have to deal with and many people don't realize. But if your income is above a certain threshold, you get to pay more. So if we look at this chart here, you can see couples equal to or below $194,000 of modified adjusted gross income is $165 per month. And that's what the majority of the population is paying. But if you make $1 over $194,000, you go up to $230 a month. That is, let's see, I put myself on the spot here, but quick math, about $65.
It's more.
It's a lot more. It's a lot more. And that's monthly. Reminding everybody that's monthly.
That's right.
And then also that is per person. So for a married couple, we're talking $120 a month. That's, $1,500 a year just for going $1 over that threshold. And you follow it the whole way down, goes up to, if you make more than $750,000, you could be paying, just for Part B, mind you, Part B Medicare, $560 per month.
A lot more.
A lot more. Right. And I didn't put the chart on here for Part D, but this also applies for Part D, the drug plan. So it's not quite as egregious, but it's still increased if you make over these thresholds, right? So how do we overcome this? Well, sometimes you can, sometimes you can't, but in some instances you can, and that's where this form SSA 44 comes in. So, Roger, what should they be looking out in the SSA 44?
The SSA 44 is a way that you can appeal the decision, the need for you to pay more for your Medicare. If, as an example, you've gotten married, or if you've had a work stoppage, or and I'm getting ahead of you, of course. So if you lose your job, as an example, and your income would decline precipitously, then you would be able to go to the Social Security Administration and say, hey, listen, I shouldn't be paying as much for my Medicare because of this potential reason.
Right. And the problem is people retire and their income changes, right? So if you made, and I guess I should back up here. So it's 2 years ago, right?
Right.
So if you retire in 2024, your Medicare premium, if we look at that chart again, it's based on your income in 2022. Well, if you retire, your income's completely different, right? So if I was over that threshold while I was working, but I'm not anymore, why should I be based on that higher premium? So that's where, like you're saying, the work stoppage, the work reduction, the bolded squares there are the most popular reasons that you go in there into Social Security and you say, hey, don't base it off of my income from 2 years ago, base it off of my income this year.
Situation now.
Right.
Situation now.
Right. So you got these 8 options, but the work stoppage, work reduction, those are the most common.
Most common.
Yeah. But notice just having capital gain on here, you sell a house. There is loss of income producing property, but just having a capital gain from a stock sale or doing a Roth conversion, these are things that can push you over that you really need to be thinking about. So we've done plenty of webinars on taxes. There's all these tax torpedoes, right? And this is one of them.
This is definitely one of them.
Right. So Form SSA 44. Important to know. So what Medicare doesn't cover, what is it? So dental is one of them, vision, and long-term care.
Long-term care.
Right. So the dental plan, a lot of people think I really need dental insurance, but it's not quite as beneficial as people, really think it is, right? Mm-hmm. If we think about insurance, we think about a lot of people have to put money into the pot, and only a little bit of people have to take money out of the pot. That's how insurance works, right? So for health insurance, that system, I'm not going to say the health insurance system fully works. There's plenty of problems. But from an economic standpoint, it can work because we have very little control over, do we develop some type of disease like cancer or something like that? So you have a lot of people putting a little bit in and only a little bit of people taking a lot out. Whereas dental, there's plenty of people that maybe aren't flossing every day. They're not maybe brushing their teeth the way they should. And so the little bit of money that goes in, there's really a lot of people that are also drawing from that pot. Right. So the economics don't work the same. So the coverage is not quite as good.
Likewise for vision. So the economics for dental and vision don't work. Now, long-term care insurance is significantly different. The economics don't work for long-term care insurance either, because there were many carriers 20 years ago, and today there are about 4 or 5.
Right. They're learning.
They're learning the hard way that that long-term care insurance is very expensive. The expenses to keep someone alive at the end of their life are very high. But importantly here, Medicare doesn't cover those expenses.
That's exactly right. And a lot of people think that it does. And there's a small, very temporary benefit if you're in the hospital and you go directly to a long-term care facility for things like a rehab or something like that. They can cover between Medicare and Medigap up to the first, I think it's 120 days of your stay there, but that's not the definition of long, right? Long-term care is you need it for years. And how do we protect our assets from some type of risk like that? Medicare doesn't do that.
No.
Really what comes into play is something called Medicaid, which is if you are impoverished. If all of your money is gone, essentially, that's where Medicaid can kick in. But a long-term care policy is really something you want even on top of that, depending on your situation. Doesn't make sense for everybody, but either way, you're not getting it through Medicare.
For Medicare. Definitely the topic of perhaps another seminar.
Yes, indeed. So number 9 here. So timing of enrollment. So you've gone through this. Why don't you tell us how this works?
Well, I have gone through it. And when I saw this slide, because I'm actually an April birthday, so it perfectly coincided with what happened to me the year ago when I turned 65. So you can sign up for Medicare the 3 months preceding the month of your date, your 65th birthday, or the 3 months after. So there's a 7-month primary, if you will, enrollment period. So you have plenty of time. The thing I would say to you about this, as you can tell, it's complex. Right. So there's a fair amount you need to know. So what are we going to say? We're planners here. Right. Don't wait till the last minute. Right. You need to begin to understand the program and get signed up early or certainly on time.
Right. Indeed. And there's an order of things we're gonna talk about in the next slide in terms of Medicare and Medigap and the drug plan. You can't get them all at the same time. There's an order to it. But before we move on from this slide, the thing I want to point out is if someone is still working and they are at an employer that has more than 20 employees, they are under employee qualified health plan. You do not have to enroll in Medicare at 65, but when you do retire, you have to enroll. There's a time frame there, and there's another form you have to fill out. There's a quiz at the end. This one's the L564. You have to fill out. So you could be 67, you could be 70, you could be 80. As long as you had qualified health insurance that entire time, you're okay. But you need to sign up for Medicare directly after that. Because if you don't, there are penalties. We haven't gotten into the penalties, and we're not going to go too deep there today, but it's important that you don't miss these deadlines.
Definitely. If you don't sign up on time, there are penalties, and they last the rest of your life.
They do. Actually, they do. Part D. Yes. So anyways, on to the next slide here. So how to get started, right? We talked about the timing a little bit already. So you really want to apply for Part A and B first. If you're already collecting Social Security, I believe Part A even might happen automatically. But nonetheless, you want to be on A and B first. And you can do that really one of two ways. You can go onto the SSA.gov website. Normally, it's a pretty straightforward process. You can apply there. Or you can go into a local Social Security Administration office. If you're less of an online person, the in-person option works. I think you can even make an appointment to make sure you're not waiting there for too long. But when you do that, Part A and B, that's when you get your Medicare number. And you need that Medicare number to sign up for Medigap and Part D. And we talk about signing up with an agent. So we wouldn't necessarily suggest that you go to an agent first to get advice on what you should do. There might be kind of a conflict of interest because they're the ones selling it. But once you kind of know, hey, here's what I want, going to an agent can save you a lot of hassle for Medigap and Part D. We work with a fantastic agent. We don't, as a firm, don't get any kind of, or as advisors, don't get any kind of kickbacks from people we refer, but she does a fantastic job of making this process as smooth as possible for our clients.
Because it can be complicated. So don't do this at home.
Right. You can have fun going on the Medicare website and looking at your drug plan and all that with the formulary we talked about earlier. But in the end of the day, using somebody that goes through this hundreds of times a year can make a lot of sense.
Yeah, absolutely.
Right. So, last but not least, if you want to know exactly how this impacts you, if you're already a client, we'd suggest reaching out to your primary advisor. We have some advisors that have gone through this, some that still have many years to go. But we can help you, nonetheless. A lot more detail that we didn't quite cover today that might apply to you. So definitely reach out. And if you're not a client, or you know somebody that's not a client, feel free to pass this along. You can scan that QR code there to set up an intro meeting, or also just go to the website there if you want more information about how we serve clients.
Yeah, definitely. Don't wait till the last minute. It is complicated.
Right.
We mentioned 10 things. There are probably 10 more we can talk about, but and we can help you walk through the process of signing up for Medicare.
Right. I didn't mention this at the beginning, but I like your shirt there,
Thank
Roger.
you.
That's Ravens
It's
purple.
Ravens purple.
Right? Okay.
Although I'm going to the Orioles game tonight, but he didn't have an orange.
An orange.
Shirt.
That purple will work.
Okay.
Yeah. And the Orioles, they're kind of doing.
They're
good.
doing great.
They're
They're way up there.
They are. So, well, thank you guys for joining. Look forward to the next one. We do one of these webinars every single month. So tune in to find out what the next topic is going to be.
Thank you.